everyone. Welcome to Breaking It Down with Jodi Marks. I cannot believe that we have made it to season 2, episode 1. Yes, we made it to 2021, and we are back and ready to give you as much information as we possibly can and keep breaking it down. So the first episode, I am so happy to bring these two amazing women that are going to help us navigate birth defect awareness and prevention, because January is the month of awareness and prevention, and we all need to start talking about it. It's not talked about enough. And especially in the Black community, we do not talk about it basically at all. So we're going to open it wide open, and these ladies are going to help us do that. So the first one, Leslie, can you please give us a little bio about yourself?
Sure. Hi, I'm Leslie Raffel. I see clinical genetics patients at the Stramsky Developmental Center at Long Beach Memorial Hospital, and I'm on the faculty at the University of California, Irvine, down in Orange County. I'm originally trained as a pediatrician, and after completing my general pediatrics training, I then went on to specialize in clinical genetics, and I've been in that field for over 30 years now.
Oh, love it. And then can you please tell us about yourself as well? I love your background at the beach.
Thank you. Hi, everyone. My name is Ioana Pal. I'm a licensed clinical psychologist, and I started in the field actually in forensics. I wanted to experience the marriage between law and psychology, and I worked with probation. I worked with foster care. I worked in group homes. I worked in a methadone clinic. I kind of jumped around because I wanted to see what I like and what I don't like and what I'm most passionate about. And I left forensics because I realized I love working with kids and families. So that's the reason why I am at the Stramsky Children's Developmental Center. And I mostly do assessments. I work with everybody on the team at Stramsky and see kids for a variety of reasons, whether I'm testing someone for learning disability or confirming a diagnosis. We do a lot of work with autism, and I do test kids who come already with the diagnosis of something like Down syndrome or other birth defects to kind of assess emotional development.
Yes. Well, thank you both for being here with us today. We're going to get right into it. So what is a birth defect, and can you please give some examples?
So a birth defect is something that develops improperly in fetal development. So it can affect any part of the body. We typically think of birth defects in terms of things that affect the structure of an organ or a part of the body. And so amongst the most common birth defects that we see are congenital heart defects, where a baby is born with a hole or an abnormal development of a chamber in the heart. Things like cleft lip and cleft palate, where the lip and the palate, which normally should come together to fuse in the midline, don't fuse together completely. Things like club feet. So there are a whole variety of different problems that are classified as birth defects.
Definitely a lot more than I thought were out there, to be honest. I have a question. Do we know how many there are out there, or is it still just an ongoing list is being made? It's in terms of what we sort of classify as birth defects, I think we pretty much know the things that can develop improperly. In terms of counting them, it depends upon how finely you draw the distinctions between things. So I talked about congenital heart defects. There are dozens and dozens of problems with the way the heart develops. And so you can classify those each as a separate birth defect, or you can lump them all together and just refer to them as congenital heart defects. Got it. So why is it important to bring awareness and get educated on birth defects?
Well, I'm a firm believer that knowledge is incredibly important. And the more that we know about things, the better prepared we can be to deal with the problem if it develops. But also, the more that we understand what can go wrong,
the more that we can try to take action in advance to try to reduce the chances of having a child who is born with a problem like a birth defect.
Mm-hmm. Exactly. Yes. We really need to be educated. Mm-hmm.
I think it's really nice. And what I wanted to add, because I definitely agree with that, I think it helps so much with planning, especially as we're probably going to talk some more in terms of families who want or would like to have more than one child, educating on what the options are moving forward or what a mother to be needs to consider. So I think the education piece and knowledge is very powerful, regardless of culture, class, anything that you can think of, because birth defects don't discriminate.
That one, though, they happen in everybody. Yes. So what birth defects are higher in the African-American community?
Well, actually, what Dr. Paul just said is very true. That birth defects can happen to anyone. And there are not a lot of birth defects that occur more commonly in certain racial or ethnic groups compared to others. They're pretty much across the board. I was thinking about it a little bit, and the one birth defect that I think has been shown to occur more commonly in the African-American community is fortunately a very minor one. It's called polydactyly, where someone is born with a little extra finger or toe. And frequently these are very tiny little extra pieces of tissue that the obstetrician will actually just sort of tie off with a little piece of suture material in the delivery room. And that is a condition that can be inherited in families, and it's a little bit more common in African-American families than in Caucasian families.
That's actually weird that you said that, because my grandma Tate actually had that. So I'm like, wait, I don't know what that looks like. Yeah. Yeah. So it's good to know that we are all the same on this big, beautiful earth that we have. And it doesn't all happen just to certain people,
Correct.
Yes, we're all the same. What are the most common birth defects?
Probably amongst the most common that we see are the congenital heart defects. Again, if we lump all of those together into one category, probably about 1 in 1,000 children who is born with a heart defect of some sort. We also see a fair number of children who are born with spina bifida, or also referred to as a neural tube defect. And that's a situation where there's an abnormality in the development of the spinal cord or the brain. Those actually are becoming less common, and hopefully we'll talk a little bit about some of the environmental reasons why we're not seeing spina bifida as much anymore as we used to. But all of these conditions are, in terms of what I think most people in the general population think about, pretty uncommon. Most of them are in the range of between 1 in 1,000 to 1 in 5,000, perhaps 1 in 10,000 children who is born with a particular birth defect. Now, geneticists think those things are kind of common because we deal with a lot of very rare conditions. But it's really when you add all of these birth defects up together, it accounts for a fair number of children who are born every year.
God, yeah, those would not be the things I would think about with a birth defect. Mm-hmm. I just wouldn't. I think when people think of birth defects, it's more what you see. Mm-hmm. And those ones are more like internal that affect you. And that's why your mind doesn't go to, oh yeah, they have a heart defect. Because you can't see their heart. It's just not a thing.
Correct.
Like you're like, oh, that's a thing. Oh yeah, that you have organs. They don't always work the way you want them to.
Right.
Yes, exactly. What are the chances of having a baby with a birth defect?
The best estimate we have is about 3 out of every 100 babies who's born will be born with a birth defect of some sort. So again, if you think about it, lumping all of them together, 3 out of every 100 babies is a fairly large group of children.
Mm-hmm. Yeah, and there are a lot of babies born each day.
Absolutely.
A lot of babies. So what genetic factors play a role in causing birth defects?
Well, that's a very interesting question. It is something that we still don't know nearly as much about as I wish that we did. And again, I'll sort of draw a distinction between genetic conditions, things like Down syndrome, which many people who are watching probably know about, versus these isolated birth defects, things that affect one part of the body. For some conditions, some birth defects, we think that there may be a change in one particular gene that causes the problem. But in more birth defects, it's probably a combination of variations in a number of the genes that we have, a number of the instructions that tell our bodies how to develop. And it's not going to be a situation where there's a major change in the gene that makes that gene not work properly at all, but maybe tweaks the way that that gene works a little bit. And that each of these little variations may make someone a little bit more likely or a little bit less likely to be born with a particular birth defect. And if we happen to inherit the appropriate combination of these susceptibility factors from our mother and father, probably then combined with some environmental factors, things that our mothers may have been exposed to during fetal development, that it's that combination of several different genetic factors along with several environmental factors that probably produce most birth defects.
That just made me think of something. If you have twins, is it possible to have one with a birth defect and one without?
Yes. Very definitely. And it depends upon the kind of twins that you're talking about. Most twins are fraternal twins, where you have two eggs and two sperm that conceive two separate babies who happen to be in the same mother's womb at the same time. Mm-hmm. And those two babies are no more alike than any brother and sister or two sisters or two brothers would be. They frequently one will have a birth defect while the other one doesn't. In identical twins, which are started out as one embryo that was conceived mm-hmm. and then split very early in development, those two identical twins, from a genetic point of view, are going to be virtually identical to each other. Mm-hmm. And so you see a higher proportion of identical twins who will both have a birth defect than you will with fraternal twins. But even with identical twins, we see cases where one is born with a birth defect and one is not.
So it's really just the luck of the draw during your development kind of thing.
To a certain extent. As we learn more, as more and more research is done, and we understand what are the factors that contribute, we will understand this variation more. But in 2021, for the most part, we don't really understand why some twins will have a birth defect when their co-twins will not.
Yeah, that's so interesting. So, and you're talking about factors. So does the risk for having a baby with a birth defect increase as we get older?
In general, not. For these kinds of isolated birth defects, it does not appear to be more common as we get older. Although there are certain situations in which age does play a role. So, for example, a woman who has diabetes is more likely to have a baby born with a birth defect. Diabetes tends to be more common as we get older. And so if your risk of having diabetes goes up as you get older, then your risk of having a baby with a birth defect related to the diabetes we would expect would be higher as we get older. And there are certain genetic problems. So chromosome problems, things like Down syndrome, are more common as women get older. And then there are genetic problems, what we call new mutations where there is a change in a gene that was not inherited from mom or dad. It's something new that occurred in the particular egg or sperm cell from which a child was formed. And it turns out that as fathers get older, the risk of those new mutations occurring in their sperm increases. And we think that's probably because as men age, and they're being exposed to more things in the environment that can damage the genes in their sperm.
And that's a good thing to note, because when thinking about like pregnancy, we don't always think about the man having a kind of role in this. I feel like a lot of women put it on themselves and think, oh, it's my fault and my body that did this. And that's a good point that you made, that it's no, he contributes. It takes two to make a baby.
Absolutely.
Yes.
I have a question, Dr. Raffel, and I've always wondered about this. Is there more of a chance of a birth defect, if we're talking about men, for those who take steroids or male hormones for whatever reason?
I'm not familiar with there being any association with the steroid hormones or male hormones. There are certain kinds of medications and things that men can be exposed to that we know can cause damage in their genes. So if we go back to World War II and the experience in Nagasaki and Hiroshima with the atomic bombs being dropped, there was very good information to suggest that men who were exposed to high doses of radiation had lots and lots of genetic changes that occurred in their sperm. We also see it in men who are treated with chemotherapy. But it turns out that all of that genetic damage also makes your sperm not survive. And so when men have been exposed to things like that, typically there's a period of time where their sperm counts are so low that they can't produce babies. By the time that their sperm counts come back to normal, the genetic damage has gone away. And so by the time that they can father children again, there does not seem to be a substantial increased risk of them having children with birth defects.
That's very interesting. Yeah.
Everybody, something new.
Yes, I'm learning a lot of things that are new. Can a baby be born with more than one birth defect?
We do see that. When we see a baby who has more than one birth defect, that's when the geneticist side of my brain goes into gear. We then start to say, could there be some underlying genetic syndrome that would explain why this child has several birth defects? And so children who are born with more than one birth defect, we will look at much more closely to look and see if there are any changes in their physical appearance. Do they not look like other members of their family quite so much as we might expect? We also look for things like, are there any intellectual disabilities, indications that might make us suspect a particular genetic syndrome? So children with more than one birth defect, we will dig a little bit deeper. We will probably do some genetic testing that we might not feel is necessary to do in the child who has a single isolated birth defect.
When you see children with two birth defects, what are there some things that like typically go together? Is it kind of just like, it's just determined? Just, yeah.
It depends upon the genetic condition. So one of the things that comes to mind is that when we're talking about congenital heart defects, there's a particular fairly uncommon genetic condition called Alagille syndrome, in which a particular type of congenital heart defect occurs quite commonly. The children frequently have sort of a little bit of a triangular shaped face with a little bit of a pointed chin. Mm-hmm. And they also frequently have liver problems. And so if I see a child who has a heart defect and also has a liver problem, I'm going to be looking at them very carefully to say, do their facial features make me think of Alagille syndrome? Because if I'm thinking of that, then there's specific testing for the gene that we know causes Alagille syndrome that we can order on the baby.
Got it. A lot of figuring it out has to do with that.
Absolutely.
Yeah.
And it's one of the reasons that I'm very happy that I work with a group of very smart colleagues, because none of us have ever seen all of these hundreds and hundreds, if not thousands, of different genetic conditions. And so one of the things that we do is we talk to our colleagues, we share pictures of children, and we pick each other's brains to try to make sure that we're not missing something.
That's very helpful, because especially with, like you said, thousands of things that you haven't seen, if your colleague sees it, it's very helpful to be like, what were the signs? What were the symptoms? Yes. So some factors again, do drugs, alcohol, and smoking cause birth defects? And if so, do we know what kinds of birth defects they lead to?
There are some types of exposures that can be associated with particular types of birth defects. Not as many as I think people out there in the community may think is the case. Probably the best described condition is what we call fetal alcohol syndrome, which is where a mother has been drinking very heavily. It normally is very heavy drinking, and typically from early in the pregnancy and throughout most of the pregnancy. And that can cause a group of birth defects that have, it's a recognizable pattern, particularly if we know that a woman was abusing alcohol during the pregnancy. The children tend to be small when they're born. They frequently have heart defects. They frequently have a flattening of the upper lip, above the upper lip, the area between the nose and the lip, what we call the philtrum. And most of us have sort of this little Cupid's bow indentation. And children with fetal alcohol syndrome typically have a very flat philtrum that in that space. The eyes can appear to be a little bit far apart, and many, but not all of these children will have behavior problems as they get older, and many of them can have learning defects or intellectual disability. So that's something that we know has been very well demonstrated to be due to exposure to alcohol. For a lot of other drugs, we may have suspicions that there may be effects, particularly when it comes to the kinds of evaluations that Dr. Pal does. We see children who can have problems with attention, have ADHD. We see children who can have learning disabilities or mild intellectual disabilities. But it can be very, very tough to really say this particular drug, this particular exposure is responsible. So we suspect that a lot of these agents do play an important role in affecting the way a fetus develops. It's not as clear-cut in most cases as you might think it would be.
Mm-hmm. And then because, there's like the social drinking, there there's a constant use, and then there's an addiction. So that's also like, there's so many spectrums of how much you take, and right. Does it matter how much you take? Or can you just have like a small sip during pregnancy? Or is that like a taboo? Like, do not do it.
Do you want to take that one?
So obviously, like was said before, there are a lot of genetic factors. There are a lot of circumstantial factors. But I think environmental factors like drugs or smoking stress can definitely influence the development of a fetus and the pregnancy overall. So before I answer that question, I do want to go back and say, there's a difference between planned and unplanned pregnancies. If we all know and heard the stories of the women who get into their third trimester and didn't know they were pregnant, right? So they might have been drinking. They might have inadvertently affected their child without knowing, for whatever reason. They didn't get medical attention. There are other situations like mental health problems or family situations that prevented them from getting the care that they needed. In an unplanned pregnancy, I think things are a little bit different. In planned pregnancies, or once a woman, let's say, is suspicious that she may be pregnant, right? Typically, let's say, I don't know, Dr. Raffel, you can correct me if I'm wrong, but let's say like 3 to 4 weeks into the pregnancy, a lot of things are already developing. The fetus is developing. A lot of the important parts in terms of brain and spine development develop. So if a woman doesn't know she's pregnant at that point and she's drinking or using meth or cocaine or heroin, although alcohol has the most negative effect on the brain and developing child, yes, certain things can happen. Once a woman knows she's pregnant, once that pregnancy, there's nothing negative about it. Let's just say it's a wanted pregnancy and they're not addicted to a substance, they can make the conscious decision to stop and be healthy and take prenatal vitamins and get the medical care that she needs to make sure everything is proceeding smoothly, right? But there are cases where women are drinking or using drugs, or even just medications and abusing the medications that were prescribed. And those type of situations definitely have an effect on a growing fetus. In terms of addiction, I think, unfortunately and sadly, sometimes the addiction is stronger than the need to be a parent. And there are women who want to be mothers, but the addiction is so strong, and without judgment, it's just, there's no comparison. And I've worked with so many women. I used to run a parenting group where the young women were addicted to cocaine, and the need to use was so much higher than their want to be a parent. And they would go back and forth between, this is my last use, this is the last day, I want this baby to be healthy, to come back 2 days later and say, I relapsed, I couldn't do it. So there's a lot more going on than just us saying stop. It's just like reaching for a cookie on Christmas, right? And you're like, ugh, I shouldn't. It's not exactly the same, but we can all understand some level of addiction, whether it's social media, cookies, cocaine, whatever the case may be. But there's a big difference in that developing fetus, whether a mother chooses to continue to use an illicit substance, or she doesn't know she's pregnant, or she continues to have, let's say, like a sip of wine, right, throughout the pregnancy. And it is very important when, like you were asking, Jodi, when that is used. If a woman uses alcohol for the duration of the whole pregnancy, I don't know about the numbers, but there's a high chance that that child will be born with some sort of fetal alcohol spectrum disorder or characteristics of it. If a woman drinks vodka versus wine versus beer, that's going to have completely different effects on the brain and developing child. If the woman drinks during the first trimester and the last trimester, there are going to be very significant changes and differences in terms of how that child functions afterward. Whether there is a birth defect or not, like Dr. Raffel said, there will be an aftermath in terms of behaviors, attention, intellectual functioning, problem solving, the ability to just adapt in the world and function well, whether it's at school, in the community, or in a job. So I think a lot of questions need to be asked, a lot more information. It's not clear cut, and every individual is different. Every circumstance is different. And what I think it's also important for everyone who's listening to know is sometimes women drink and use drugs to escape a pretty bad situation. I've dealt with women who were in such terrible domestic violence situations, or I've worked with 16, 17-year-old girls who were pregnant, unwanted pregnancies, and were using to have energy. I've worked with women who were prostitutes, And because they needed to make money, they would use cocaine to have more energy during their pregnancy. So there's a lot of circumstances. We can't judge a woman for using without knowing the full history and knowing what she's willing to accept in terms of help.
Mm-hmm. And that's hard because you don't know their past. And then also the side effects of, like you said, later on when the child might have comprehension might be different, taking in just maybe math or reading or something like that. And then the parent has to look back on their pregnancy and then they're like guilt. And I feel that like emotional, like heaviness, like, oh, I had to do it to get by on a day. Like you said, some women have, like, that's their way of coping. But then you're like, oh, but then it led to this. That's just an emotional.
It's a roller.
Yeah.
And there is no easy solution. And guilt and shame are huge motivators, not necessarily positive motivators, but they're definitely motivators for us to do or not do the right thing at any given moment. So I think that's where we need things like this, podcasts and education, where we can show women, yes, you might have made a mistake. Maybe you didn't take care of yourself 100%, or you were in a bad situation, but there's always some sort of help there. Someone who's willing to talk to you, someone who's willing to provide you with shelter, information, a phone number to help you get through it, or to deal with that burden of knowing that somehow you might have contributed to something, right? Because not everything is 100% something that we can blame. And there are women, I'm sure Dr. Raffel can agree with this, there are women who drink and smoke and who knows what they use during their pregnancy, and there's absolutely no negative effect on the child being born.
Absolutely. Right. I think it's also very interesting. In all the years I've been in practice, I can't think of a single mother I ever spoken to who said, I drank or I smoked, did drugs during the pregnancy because I wanted to harm my child. Okay. Mm-hmm. And I think it's important to remember that guilt is an emotion that we should feel if indeed we've done something intentionally. When something has happened by accident, when we did not know that drinking during a pregnancy could be associated with problems for our child, how can we feel guilt for something that we did unknowingly? And again, most parents care tremendously about their children. Most parents want to do the best for their children. We see lots of women who did not know that they were pregnant at the time, that it was New Year's Eve and they went out and they had that bottle of champagne. And then they find out afterward that that may have increased the risk of problems for their children. And the whole question of addiction that Dr. Pal raised is incredibly important. We do things sometimes because physiologically our bodies have such cravings that they're things that, despite our best intentions, we absolutely cannot control. Mm-hmm. And if indeed you're responding to a craving like that and you fall off the wagon, it's a very sad thing, but it's not something that you're doing intentionally.
That's very important, especially as a parent. I could only imagine like you said, the guilt, but at the same time, it's like, but you didn't do this like intentionally to your child. But we're human. We're all going to feel that guilt at watching your kids struggle. That's the thing. We're just like, oh, I even just not having a child with a birth defect. Every parent is like, oh, I'm guilty. Oh, I did something wrong. Oh, did I do this with my child right? Did I raise them right? Are they going to be this person? I think it comes with being a parent. I think that just comes with the territory. You're just going to worry about your child no matter what. So, but absolutely. This is definitely harder. Yeah. What other causes lead to birth defects?
Well, one of the things that can cause some birth defects that I don't think people are particularly aware of are infections. Now, if we go back a couple of years ago, ago when there were these children who were being born with microcephaly, very small heads, due to the mother having been exposed to the Zika virus. That was something that got a lot of publicity. And we definitely know that the Zika virus can cause severe problems in brain development. But the CMV, which is a very common virus that most of us are exposed to at some point in our life, that can cause either a mild cold, flu-like symptoms or no symptoms, or in some people can cause a hepatitis kind of picture, is a major cause of hearing loss in children if mom gets CMV while she's pregnant. Back now we have vaccines, and German measles is not a very common thing, but German measles back in the 50s and 60s was a major cause of birth defects. Again, intellectual disabilities, heart defects, small stature, cataracts, a whole variety of things that we learned were due to moms having German measles while they were pregnant.
But that's also something to think about, thinking about how just the COVID-19.
But I think it's also important, based, on what we're talking about. Yes, we don't know that much right now, but if we're open and we read and we educate ourselves and look at all the data in terms of COVID or any other defect or diagnosis, it can provide peace of mind, right? If you go into the doctor's office knowing that you can get some answers versus not asking, because there are a lot of parents who are afraid to ask, right? They don't want to know. So I think it's important to just step back a little bit and kind of weigh in, like, how will I be able to help my child if I ask the questions? And how will I be able to help my child if I don't? And probably the answer is, it might be uncomfortable for you, but you need to ask the questions and trust that the providers who are providing the care for you and your child, whether you're pregnant or had the child, know, or they're doing their job, or we're learning to know more to help you, whoever that may be, so that there isn't that fear, right? Or that we have a little more information like you're doing with us now through this podcast to inform other people who may otherwise be a little bit anxious, nervous, or apprehensive about learning something new because A, it's not talked about in the community, right? Or B, no one's been brave enough to ask about it yet, right? Or there's something bigger out there and this is just kind of under the rug, right? COVID has taken all the attention, 2020, right? But there are all these things, like, for example, flu, right? Who's talked about the flu? Nobody's really talked about the flu because everybody's talked about, COVID. The same thing with birth defects and information and diagnosis, anything you can think of. We still have access to information. We just need to use it in good, positive ways. And I think that also means that we should never stop learning, whether you're in one community or another, and just keep putting yourself out there. Whether you're a provider or a parent, it doesn't really matter.
Yes. And then you said the knowing versus not knowing kind of. That leads me into my next question. How can a person find out what caused their baby's birth defect? Or even say before the baby's born and you might think something runs in your family, how do you go about that? And do you even want to know? Like you said, a lot of people don't want to even know.
Knowing or not knowing is a choice that every couple should make for themselves. And one of the things we feel very strongly in genetics is that our job is not to force information on people, nor is our job to tell people what to do. What we want to do is provide information to people who are interested in it. There are genetics programs in every major city in the country. If you live in a smaller community, you may have to travel a little bit farther to talk with a clinical geneticist or a genetic counselor. But those are services that are available. if a woman is pregnant, she should definitely discuss whether genetic counseling and genetic testing is something that she might benefit from during the pregnancy. And I also encourage couples to think about these things before they become pregnant, particularly if a woman has some sort of chronic medical condition that requires that she take medication. Talk to your obstetrician, talk to the doctor who is treating you for that chronic condition. Find out if there's anything known about the medications that you're taking in terms of risks for birth defects. Mm-hmm. There are situations where if a woman is interested in being pregnant, she can actually be switched from one medication to another medication if there's more information about the safety of the second medication during a pregnancy. And so there are those kinds of management choices that a couple can make if they talk to their healthcare providers that hopefully will reduce the risk, but also give them more information so they know what kinds of things they may be at higher risk for.
Mm-hmm. Mm-hmm. Yeah, especially you always not like see in movies mostly where they're like that conversation where like, do I want to have a kid because I said I could have this? And that's the emotional part. Do you want to have a child that could possibly have this? And also, do you have the means to give that child the right kind of life, like environment, the love? Can you give that child? Can you really, really see yourself going to doctor's offices and getting your child the help they need? Because that's another question that I think a lot of people don't ask themselves. They go, I want a child so bad. But then I'm like, but do you have the means to go and actually take care of this child with, a birth defect? Because it's not just one trip to the doctor's office. It could be many. And there's like, I want a child. And there's that emotional aspect after the fact of, can you even handle it?
Right. And if indeed a family has a baby who is born with a birth defect, in many cases, there is no advance notice. As good as ultrasound is, as much genetic testing as we can do, we don't detect all birth defects before a child is born. And what I think it's important for families to know is that there are tremendous resources that are available in the community to support you, to support your child, to make sure that your child is getting the best possible medical care and that you are getting the psychological support and the financial support that you may need to take care of a child with special needs.
Mm-hmm. That's very good. Mm-hmm.
Like I said, there's always some organization, an agency that will be able to provide all of that if you ask the questions. And again, like Dr. Raffel said, we can't force anybody to do a certain test or want to know something, but we can provide the information of the pros and cons and then allow the couple or the mother to make the decision for themselves whether or not they want that information or not. Or, there's a lot that goes into this pros and cons list. But I think providing the information, being available, and sometimes even breaking down appointments into multiple appointments. Sometimes, a person can only take so much during one visit, right? Mm-hmm. So I think providing that information verbally and writing, providing the resources, right? And then having someone like a genetic counselor come back and say, hey, do you have any extra questions? Is there anything else that we can go over that maybe was too much? Like you reach that limit, when everybody who goes to the doctor's office and they listen to anything, you're kind of like 3 out of 10 things got in, right? Everything else is kind of like, wait, there was a word the doctor mentioned and it had something really long in it, right? So I think as long as we know that it's okay and there's nothing wrong with asking questions, there's nothing wrong with going back or sending an email to the doctor and saying, I'm sorry, can you please explain it to me again? Nothing wrong.
Mm-hmm. And you said ask the questions. How can one get help and ask questions on how to prevent birth defects even before becoming pregnant or while pregnant?
You can look up in your local phone book for a genetic counseling service or clinical genetics program. While many of the birth defects we deal with are not necessarily related directly to genetics, we have been trained to try to distinguish those situations and hopefully have the information that will be helpful to people in understanding if they're at risk or not. Fortunately, some of the national organizations in the genetics community have very complete websites that are available. The American College of Medical Genetics, which is an organization that clinical geneticists such as myself belong to, has a Find a Geneticist site on their website. The National Society of Genetic Counselors also has a Find a Genetic Counselor service, so that you can go to the web, you can go to the website, you fill in your zip code, your city, in some cases, what kind of counseling you're looking for. Are you looking for prenatal counseling? Are you looking for cancer counseling? Different kinds of specialties. And they can give you a list of individuals who are in your geographic area who can provide that service. Also, women should talk to their obstetricians. Obstetricians refer to geneticists on a regular basis. They will certainly know the services that are available in your community. Ask questions. Don't be shy. Don't sit there and be worried. Open up your mouth. Ask the questions. Ask for help. There are people who are willing and able to give it to you.
Mm-hmm. Yeah, a little self-care for your like before your pregnancy and while you're pregnant is always a good thing. Yeah. So how can a person with a birth defect get help they need? I know you talked about going and seeing clinical geneticists and genetic counselors, but how do they get that emotional support?
From the time that a baby is born and has a birth defect, a family is going to find themselves surrounded by people who are willing and able to help support them. The doctors in the newborn nursery or in the intensive care nursery, if the child requires that, the nurses in the NICU, the social workers in the NICU are all going to be sources of support. These are people who are very knowledgeable. If you have a child with a birth defect, I guarantee the people who are providing care for your baby have taken care of many other children, and they're going to be able to make sure that the appropriate people are consulted. Usually care for these kinds of conditions takes a village, takes a medical village with multiple specialists, each contributing their own expertise to the care of your child. But also that team always will include psychologists, social workers, counselors of a variety of different backgrounds who are there to try to help you with the emotional adjustment and trying to help make sure that you are getting your needs as the parent taken care of, in addition to making sure that your child is having his or her needs met.
I also wanted to add to that. Sometimes I think we focus so much on the medical piece of it, which is very important, providing the information and the resources and interventions for the child and the parent, that sometimes we need to really use that village, like Dr. Raffel was saying, to step back and realize when it's too much, when we need to give mom a break or provide the type of support like I don't know, maybe respite care or something like that, or a parent partner, or something where mom can go out for 2 hours without exploding, just taking a little time to herself, or just taking a bath and knowing that someone else is watching the child, right? If there's no care in the home, if there's care from someone else in the home or using the extended family, that's great too. But I think sometimes it's important to realize when it's too much and when we need to take a break before continuing with more appointments, with more information. And yes, absolutely. Social workers, psychologists, therapists, child life specialists, they're all there to support the team of providers. But I would add to that also school personnel, because if you have a child, like you were talking in the beginning, Jodi, the visible markers, right? Like the visual parts of a defect, that's very different than a child who had some heart work done, right? And nobody knows about it. Everything's fine. You're going to have factors like bullying, right? Or learning disability come up. So you want on your team in that village also a school counselor or someone who can help set that part up so that the parent doesn't have to worry about school in addition to everything else. And sometimes the smallest thing, like providing transportation to those medical appointments, can mean the world to a parent who can't do that anymore, or for whatever reason, the car is in the shop, right? Mm-hmm. The little things sometimes add up to much more than all the information we can provide in one visit. So it's very important, like you said, the self-care, the information, being aware and kind of reading a situation to understand what's going on. But it's important for the parents to ask the questions or to say, I'm moving, or we're switching schools, that right now is right here. Can we kind of slow it down on the medical appointments and the recommendations or surgery talk, or whatever the case may be, so that we can focus on that, kind of have the roof over our head kind of established, make sure we're moved in, everybody's okay, and then we can take it up again and see what else the child or the mom needs when, the basic needs are met.
That's very important, because I never really would have thought about that, like giving the parent time to breathe, because they are human. Things are going to weigh them down and make them feel like the world is on their shoulders, especially if you have multiple children in the household. I can only imagine that also taking a toll on you, because you're trying to juggle how many kids that you have. Yeah. And oh my goodness, that would be a hard one. If you, like you said, don't have a village to help you, or you have, people wanting to help you, especially, I know certain communities, especially in the Black community, we all call them aunties and uncles. So like you'll have somebody in your corner coming to help you no matter what. And I think that's very important especially when you are getting just so much, just sensory overload, I guess, in a sense of just, what are you going to do? Yeah. And do you see that a lot?
We need that. I think all of us, including ourselves, right? It's kind of, I know we're not traveling now or shouldn't be traveling, but it's kind of like the oxygen mask, right? If you don't put the oxygen mask on yourself, you're not going to be able to help the person next to you, whether that's a child or someone else. So yes, you need to be superwoman as mom, right? To take care of everything and make sure your child is taken care of. But you have a limit too. I mean, we're not women of steel, no matter what, right? So I think refilling our reserve capacity, making sure that our tanks are full, whatever that means, whether it's taking a bath, going shopping, sleeping, whatever that is, right? Looking on social media, it doesn't really matter. You need a mental break. You need a physical break. And we all need to know what that is, because if you're just doing something because someone says you should be doing X, Y, and Z, and that's not how you cope and that's not how you relax, it's not going to matter. It's just time that you did something else, right? Mm-hmm. So I think it's very important to know kind of what you need, what your child needs, get that done. Use aunties, use uncles, use the community, use agencies, use doctors, whatever you need to get back up there so you can do what's best for your child. Because then we don't have to worry about guilt. We don't have to worry about shame. We don't have to worry about anything else, because we've taken care of as much as we can.
Mm-hmm. And that's very important. And what is a clinical geneticist or genetic counselor?
Okay. So there they're two complementary fields. We're different professions. We work together very closely. I'm a clinical geneticist. Clinical geneticists are trained as medical doctors. Most of us have done training in pediatrics, internal medicine, obstetrics, and gynecology, one of sort of the basic specialties. And then most of us has gone on to do a second residency in genetics. It's usually 2 or 3 additional years of training after you're a card-carrying doctor and trained as a pediatrician or an internist. But specializing in learning about inherited conditions, things that are due to changes in our genes. Genetic counselors are people who have gone into a master's program in genetic counseling after completing college. Most genetic counselors go into the graduate program having a pretty strong science background, but the field tends to be appealing to people who are not only interested in genetics as a science, but also people who have a tremendous desire to help other individuals. So genetic counselors tend to be very caring individuals, very supportive. They are trained in how to provide that psychological support as well as the scientific information. And we typically, geneticists and genetic counselors work together, and we try to form a team that can provide as much support, both the medical information, but also the psychological and emotional support. We try to provide that for families as well.
Mm-hmm. And you talked a little bit about how you find them on like the website. And is it also like word of mouth? If say they have like their main doctor, and they're like, this person's really good for this kind of genetic,
Yeah. Like everything, it's always good if you have a healthcare provider who has worked with a genetic counselor or geneticist before and can say, I really know that this person is very strong at what they do. Also, talking to your friends. Genetic services are being used increasingly in the community. And so if you are talking to friends or colleagues, you may be surprised that many of them have worked with genetics professionals before. And if they've had a good experience, that's a good starting place as well. Unfortunately, one of the problems we have is that there are not nearly enough individuals from minority communities who are in the genetics community. And I think we have a problem that the word has not gotten out as well. Genetics is a relatively new field. We're a relatively small field. And so if indeed you do not have a friend or family member who has worked with a geneticist or a genetic counselor, you may not have ever heard of the field. But we would love to get more members of minority communities involved. We need more genetics specialists, and we are hoping that we can get more and more people aware of this as a possible profession.
Mm-hmm. Yeah, I know, especially in lower income communities, it's harder for those schools, I guess, to have those big like fairs and everybody like talks about, this, but I think it's important. Like you need to show a child that there are so many different fields out there and there are so many ways that you can be, useful and help. And like this, like a lot of people don't know that you can literally be helping people through what you both are doing in such an impactful way, because you're not only helping the child, you're helping the family as well, like you said, with all of everything they have to go through on a daily basis. And I feel like a lot of people would be more like willing to do that, because when I talk to friends about wanting to go in medical, they always talk about like what you see on TV, like Grey's Anatomy, like I want to be a surgeon, and I'm like, but there's more to being like in a in that field than just the cookie cutter. And I feel like we need to talk about this. And that's why I really wanted to bring you both on, to also show the education side, because a lot of people don't know that you can go and do this. And so how would you go about doing this? Like, where would you go? Like, what college did you go to? How did you guys get into this?
A lot of it is exposure. A lot of it is hearing about fields, but a lot of it is also going to the library, going online, and educating yourself. I got into genetics because when I was a freshman in college, I took a genetics class and I aced it. It was so easy for me. And a lot of my friends who were also biology majors were saying, that was the hardest class I've ever taken. And you suddenly realize that your brain works in a certain way. And my brain worked that way. And it made sense to me. And I was excited about it. And I wanted to do research in it. And I also wanted to help families who had children with genetics problems. And it was just a win-win for me to be able to put all of that together. Mm-hmm. One of the things that is being done in the genetics community right now is outreach to minority communities to try and make people more aware of genetics, not just if you have someone in your family who could benefit from genetic services, but also making people aware of the many different kinds of professional career opportunities that are there. It's not just the clinical geneticist or the genetic counselor. There are genetics nurses. There are laboratory researchers, laboratory technicians who work in DNA labs. There's just a wealth of different opportunities that are available. And there is some outreach that's being done. There's a website called, I believe it's minoritygenetics.org. And one of the things that they're offering there are mentorship opportunities. So if indeed you're someone who is interested in exploring the possibility of a career in genetics, you can be matched with someone who is in the field, who can take you under their wing a little bit and introduce you to what goes on and explore different options with you, because there are many, many different kinds of ways to get involved in genetics that don't involve going to medical school necessarily, don't necessarily involve going to graduate school. Although those are opportunities that are out there. What we want to do is make sure that people are aware of the different opportunities that are available. And if you're excited about something, pick up the phone, call your local genetics center and say, I want to learn more. Can I come shadow somebody? And you will find that people will be excited. We want more people in the field.
Yeah. And it's interesting because I think we have a unique situation at Stramski where we have so many different specialties in one outpatient clinic where we're able to kind of collaborate and work. Whereas if you were in one specialty clinic that only deals with genetics or only deals with craniofacial or only, behaviors, you're going to miss out on some of those opportunities, whether you're a student, a provider, a parent. But I think the fact that we are able to look at everything from so many different angles and provide those opportunities for students who might want to be in the field, I think that's a tremendous opportunity right there. So we definitely, not just for me in terms of psychology and genetics and counseling, but I think in general, the opportunity to kind of intertwine and kind of cross-collaborate across fields, it's amazing because that's what opens doors, not just for people working in the field, but also providing better care to the populations we serve. And for me, it wasn't genetics that I started with. Obviously, I've wanted to be a psychologist since I was in junior high. But for me, the basic question, and for most people who study psychology, is the nature versus nurture. So for me, it started more like, well, how important is the environment and upbringing, and how much does it matter what your genes are made of, right? Or any kind of mutation. So for me, it started with that question, but I love being where I am now, where I get to learn still. I get to read on stuff because sometimes I'll get a referral from Dr. Raffel or from other geneticists from our clinic, and they'll want me to test for ADHD or look at emotional functioning, but they'll say, this child was diagnosed with XYZ. And I'm like, what is XYZ? But I'll get to read, or they'll send me the articles that I need to focus on so I can understand, because sometimes knowing the medical situation helps me, because I can say, okay, these are the results of my psychological testing, but not all of it is because this child has ADHD. Part of it is because it really falls under the umbrella of this medical condition or birth defect or characteristic, whatever you want to call it. Mm-hmm. So it's important to know all of that. And you can't know that without the collaboration, without learning a little bit more about something that's not exactly in your field. So with students, I'm hoping post-COVID, we're going to have a little more collaboration, because that is also now something that you need to kind of do and see in person. Mm-hmm. Helps to be part of the appointments. I know Zoom is amazing, but sometimes you just need to be in the room and feel the energy of a parent who's receiving new information or overwhelming information. You can't really read the situation on Zoom. You can't see when someone's tapping their foot, right? Mm-hmm. You can't tell when someone's picking at their nails, right? Because they don't know when to jump in and ask the right question, or if they're asking the right question. So all of that, I think, is just amazing opportunity for anybody, no matter what community you come from, to just jump in and do something a little different that's not the most popular thing.
When you say doing the psychological tests, do you have to do them over Zoom during this time?
For me personally, no.
And that would be so hard.
Personally, I've been taking people in. So if the kids can keep their masks on and the parents can keep their masks on, I have been seeing them in person. And honestly, the only reason I have chosen to do that way, it's either to say no to testing, we'll wait, or do it in person, is because of all of that, like all the nonverbals, being able to get a fuller picture. And also because it takes twice as long to do it on Zoom. And part of the testing, you have to do things in a standardized way. And when you're doing IQ testing, or you're doing other kinds of achievement testing over Zoom, you have to coach the parents to react or not react, to repeat the instructions a certain way. And that's just, I think, stressful for everybody. And then you have the child responding to the parent rather than a stranger. And sometimes that helps, but sometimes that muddles things. So I personally do testing in person, if able to. Some kids, I just say, you know what, let's wait another couple of months. It's not really going to matter that much, but it really depends on the referral question and why they need to be tested.
What types of things would you test? I'm very curious now.
In terms of like birth defects or in general? Okay.
Kind of both. I'm interested.
So, I guess let's kind of take a situation in terms of craniofacial abnormalities. So anything visible, right? Sometimes I will have a referral for a child who has cleft palate or anything lip. Let's go with lip, where the testing that I need to do is to see if it's just the visual, just the craniofacial part of it, or if that child suffers from anxiety, if there's a bullying situation at school, if there's a learning disability, or if there's something like ADHD, where it might not have anything to do with the actual birth defect, or other diagnosis, medical diagnosis, but all other factors have led to, let's say, a child not doing as well in school. Okay. So then I would do some testing to kind of look at visual processing abilities, to see if their auditory processing difficulties, like Dr. Raffel was talking about, certain viruses cause auditory problems, and sometimes it's just auditory. Sometimes it's how the information from the ear to the brain translates. And I need to find out if the child's having difficulties with that area, because if that's the case, then a child who just listens to instructions is not going to do very well. But if they can read, or they can have that information taught to them in a different modality, in a different way, they can do just fine in school. And sometimes with kids with birth defects or not, any kind of medical situation where there are a lot of appointments, they miss school, or, they have a lot of other things to deal with. So sometimes it's the stress, and sometimes I'm looking at depression, I'm looking at anxiety, I'm looking at attention, where that's not, let's say it's not the primary problem, but everything else in their life is kind of adding to the whole pot, right? And it's difficult in terms of friendships, relationships, family life, not taking their medications, right? Being a little more defiant. And sometimes not because a child is misbehaving, it's because they don't have better coping strategies, and they're acting out because they don't want to go to another appointment. They don't want to look different, right? And that has to come out somehow. And that's why I'm saying, even with the parents, if they have a break and they can kind of ground themselves again, feel good, they can pay attention and notice the little things before they become big.
Mm-hmm. That you keep bringing up bullying, and I think that's so important to talk about, because in school you definitely see that with children that tend to not look like the other kids. I don't know when we decide that we're just gonna start being bullies for some reason, but when do you think it would be a good time to kind of introduce birth defects to children, so they know they may have look a little different, but they're not different. They are just, they're human. Treat them like they're human. They should get the same respect that every other kid that you give them. That's the one thing that I always want to say. I'm like, give them respect. They do not need less respect just because they look different.
Again, that one I think matters a lot, but it also depends on so many factors. How open is the family? You started this discussion with us today about how this is not a very discussed topic, right? In your community and other communities as well. I think there's certain topics, even bullying, where we don't talk about it, or we act a certain way against it, right? I think it really matters how open you are and willing to talk about anything. Any sensitive topic should be discussed in a family who's willing to discuss it. When you have that openness and the ability to talk and allow questions, I think there's less of a chance of a child being bullied or bullying someone else, because there's that flow, there's that communication, right? There's that curiosity, right? And asking what makes that person different, or why is that person being treated that way, or why did that kid look at the other kid funny, right? But when you don't have the education or the willingness to ask those questions, that's when problems come up, right? It doesn't matter if you're in first grade or in seventh grade. And I think, and I don't mean to bring up bullying in a specific way or more than it needs to be. It's just, I see it. And for a lot of reasons, when kids start coming to me and opening up to me about why they're not doing well in school, you get answers like, well, I don't really like to look up. This is a true story. I don't like to look up at the board because when I look up, the light kind of hits my face and the kids can see my lip. Something as simple as that, right? But who's going to take the time to ask that kid on a daily basis why they're not looking at the board, why they're not taking notes, right? And sometimes it's that anxiety and that shame or whatever perception they have of themselves, the self-esteem, that's getting in the way. It's not because they're not good at math. It's not because they can't do science projects. It's because there's something else going on. So that falls, I don't know, does it fall on the teacher? Does it fall on the child to be taught certain things? Should it be mandatory for every first grader to have some sort of like kindness training? I don't know. I think we can all do a little better no matter what our field is in.
Mm-hmm, mm-hmm. Everybody, no matter what age you are, there's always bullying, unfortunately. We all have to learn how to kind of walk in each other's shoes. Absolutely. I found while doing this podcast and this show, we don't tend to see other people's perspectives enough. We kind of just think like, oh, it's not affecting me. I don't have to deal with it. But no, you should get an understanding and educate yourself, because it'll help you so much in the long run of how to communicate with people, how to have a deep understanding of how the world works, and with this episode, I just want to thank you both so much, because I've learned so much. And now I'm excited to go research and also tell my friends and also some of my cousins that are in high school that they should, get into this field. And they're going to be like, stop pestering me. I'm like, you wanted to be a doctor. Now I'm just telling you should maybe do this field. But thank you both so much. But the last question is going to be, after everything that we have discussed, what is one thing that you would want the audience to take away from this episode?
I would hope that people would feel a little bit more informed, a little more compassionate, and feel a little bit more prepared to seek help, seek information when they need it.
I would also add brave, being a little more brave. Hopefully after this podcast and after doing a little more researching, to really just ask, because you don't know if it's a good or bad question until you ask. And I think the other thing that I really want all of us and anybody listening is to know that you're never alone. Whether you get the help or not, there's guaranteed someone else going through something very similar, if not the same, or receiving the same news that you're receiving, or trying to understand what a certain word or diagnosis is. So it's never a one person thing. I think that's why collaboration is needed. And that's why social media, podcasts, support groups are really important, because you can transfer the information, you can share the information so that you truly feel like there's someone else out there who understands this. There's someone else who knows who can understand me, and they can send me in that direction. Or I can call this number or go to this website and find out more. So I think we're never alone, no matter what.
And thank you both again for being on our first episode of season 2. We started off with a bang, and I'm so excited. And also everybody listening and watching, we're going to have links and everything that you might want to look up, any websites or anything that they've talked about. And I hope you can educate yourself more on this topic, just like I'm going to do. And I hope you all have an amazing day. So goodbye. Thank you for watching, and watch out for season 2. The rest of it, it's going to be coming at you every Wednesday, and I cannot wait for you all to see the rest. So have a good day. Bye.